now we're going to do an IV push medication. And our doctor's order is to give 200 milligrams of Practi powder IV push to the patient's stat. So what we're going to do is go ahead and do steps 1 and 2 like we did with the reconstitution and the drawing up. So we would reconstitute our Practi powder, and then we would calculate again how much to draw up. Again, that's the same dosage, so we would use D over H times Q, and in this case I'm going to end up drawing up 1 milliliter. So I've got 1 milliliter already drawn up in my syringe because I've already done all the math calculations. The other thing I'm going to want to do is to look this drug up in my drug book, because whenever I look this up, I want to see 2 things that are really important. I want to know if I need to dilute it with anything, such as normal saline, because I may not be able to give this straight into the patient's vein. And I also need to know how fast to push it, over how much time. Can I just slam it into the vein, or do I need to give it really slowly so it won't irritate the vein? So I need to look this up. So let's say I've looked up my Practi powder in here, and for this particular medication, I don't have to dilute it, which means I can give it straight like it is, and I need to push it over at least 1 minute. So when I get into the patient's room, I need to already kind of have calculated in my mind how fast I'm going to push that. So if I'm going to push a cc over 1 minute, that means I'm going to push about 2/10 every 12 seconds. And if I do that every 12 seconds and kind of watch my watch as I'm doing it, that will mean that I will give that whole cc over an entire minute. So you push about 0.2, wait about 15 seconds, push about 0.2, wait about 15 seconds, and push about 12 to 15 seconds. And so that should come out to be about a minute. So now we're going to go into the patient's room. So I'm going to need an alcohol pad and my medication with a label on it. Make sure you label this before you leave the med room. So we're going to come into the room. The first thing we're going to do, of course, is we're going to wash our hands. And as we're coming in there, we're washing our hands, we're going to need to ask the patient a couple things. Mr. Arm, are you allergic to any medications? Because I'm going to be giving you your blood pressure medicine today. No, he's not allergic, so you always verify allergies. The next thing you want to do is check your medication with your MAR at the bedside. So you should verify this medication. Also verify the patient's name and birthday. Can you tell me your name and birthday so we're sure we have the right patient, the right medication, and make sure he has no allergies to the med. If you're in a room where there's a computer system, you may not have a paper MAR like this. You may simply have to scan the medication to the computer and look at it. We don't have to wear gloves for this procedure because this is a closed system. I'm going to take this needle off and screw it onto this port. Therefore, there's not a big chance that I'm going to become contaminated with blood or body fluids. So that gives me better dexterity without my gloves on. Now, when I walk into this particular patient's room, I notice that the IV is running. If the IV is running when I go in, I simply check my site to be sure there's no swelling, there's no redness. I'm looking for infiltration or phlebitis. If there's none of that present and the IV's running okay, then I can simply push this medication. That means I don't have to flush it before, and if it's running, I don't have to push after. And I'm going to demonstrate that. I've put red medication in this syringe so you can see what happens with the medicine as it runs. If the patient did not have an IV that was running and they had like a saline lock in place, then you would need to flush it to check for patency of the IV before, and then you would need to push the medication and then flush behind it to flush the medication out of the tubing. If it's running, you don't have to do that. Some instructors may tell you when you're at the hospital that when you're doing this that you need to clamp your tubing, push a little bit of medicine, unclamp your tubing and let it run through, but that's really not necessarily the case, especially with our pump system now. So if you are in a clinical setting and this happens, simply do what your instructor asks you to do, but it's not necessary, or explain to them the reason that it's not, and we'll take up the issues from there. So now I'm going to show you what we need to do from there. So we've verified allergies, we know we have the right patient, we know we have the right meds. So we're going to clean our port, and when we clean it, we're going to clean it kind of round and round where it's not up and down and back and forth, because this tubing is round, and really clean it because this has been laying against the patient's arm. So we go ahead and clean that again for about 30 seconds, just like we do any other site. Once we clean that, then we're going to want to hook our tubing on. So I'm going to take the needle off, and that's the reason this is capped, is to keep it sterile. So we'll push this on. And remember, we've done our calculation. So I'm going to push like 0.1, which is 1/10, and then I'm going to wait like 12 to 15 seconds before I push the rest. So make sure that you can see your graduated part on there. So I'm going to push 0.1. And you notice it goes in there. So if you'll notice my IV's running, notice how clear that's getting. It's going to push the medication through. Okay, so I'm going to watch. I'm going to look at my watch. I'm going to wait about 12 seconds. I'm going to push 0.1 again. And see, it's not backing up in my tubing. That was what I wanted to demo for you. It's actually going on into the patient's arm. So then I'm going to push 0.1 again. Wait 12 seconds. And for the sake of the video, we're going to advance this just a little bit. 0.1 again. Wait. 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 And notice the medicine's clearing. It's still not coming back up in my tubing. So just keep pushing 0.1 and waiting your 12 seconds. 0.1 wait, 0.1 wait, 0.1 wait, 0.1, and then when you're finished, your IV should flush it completely because this one's running. So over a period of a few minutes, this is all going to completely run into the patient's vein. And so that's all there is. Clean up your mess, and you're finished with your IV push.